I am the food service director for the school district, and the superintendent asked that I lead the writing of a wellness policy for the school district.
I'm a member of the Health Council, and I represent a couple of factions. I'm a parent in the school district, so I have a middle schooler and a high schooler, and I'm also a registered dietitian. So I'm here partly because I have that expertise in my background also. So I've been a member of the group since we got started to develop the school wellness policy.
Basically, this committee, the School Health Council, what our charge is we used to be what we call the Wellness Policy Committee. And when we were the Wellness Policy Committee, we were an ad hoc committee, which means we were just charged with doing one task, and when that task was done, our committee no longer existed. Our task was to write the wellness policy. So we wrote the wellness policy. Within the wellness policy, there's a requirement for the school district to have a school health council that their job is to implement the policy, to monitor that the policy is being followed, and as necessary to review the policy.
Well, I think it's interesting what we did here in State College with the wellness policy, because instead of trying to go straight to where we really probably want to be down the road, our group tried to look at it as a long-term plan and realize that you can't change people's eating habits, kids or adults, in a very short period of time.
Our wellness policy does touch on the school lunch program, but the reality is the national school lunch programs are already very thoroughly regulated. There are nutrient standards for the school lunch program that USDA has. All school lunches have to provide children with a third of their calories, a third of key nutrients, can't exceed 30% calories from fat, can't exceed 10% from saturated fat. So there already are a lot of regulations to make sure school meals are healthy. The reality is I know a lot of people have a perception that school meals aren't healthy, but what we try to do here at State College, I know a lot of school food service directors are doing the exact same thing. We really try to balance meeting the USDA regulations and then also meeting our students' taste preferences.
There was an article in the school newspaper doing the pros and cons of the wellness policy, and in fact it was fairly inaccurate. Their perceptions of what was happening and why it was happening and everything were really off.
We set some nutrient standards for all foods that are available in the school, and we started cutting back and limiting some of those choices. And we've definitely seen an impact in the school lunch program because middle school students can't buy more than one snack a day. More of them are buying meals because I think in the past they would buy maybe 2 or 3 snacks and that would be their lunch. Well, now they can't do that. So we definitely are seeing lunch participation increase. We're seeing breakfast participation increase. We're selling more milk this year. Meal participation went up quite a bit this year. It costs more to prepare and serve a lunch than it does to prepare and serve a snack. To make turkey hoagies or make chef salads or prepare food items actually takes more labor, is more involved, and the food cost for those items is quite a bit more. The food cost on a snack item is generally in the area range of about 35% food cost, whereas for a lunch about 57% of the cost of preparing the lunch is food. So it's much more expensive to provide lunches than it is to provide snacks. So our program is going to lose money this year. Last year we were able to operate in the black. We covered all of our expenses. This year my program is going to lose money. All adults want kids to eat healthier. They want kids to be more active. They want kids to grow up to be healthier.
Boy, parents I have talked to, they think it's always better if kids eat more healthfully.
Where there was a lot more work to be done, I think we're in things that are considered competitive foods. And competitive foods are those foods that are sold in schools, sometimes in the cafeterias, and then also in vending machines, in school stores, as fundraising efforts. We spent more time and targeted more looking at those things because they are not regulated. Well, we just went through several evaluations, different kind of evaluation tools. So what we're going to do, we have a meeting in May, and our plan is to go through those evaluations and look at the areas where we did fall short and kind of set some targets and goals for, how can we improve those.